This is a series of 3 patients who developed periorbital swelling after neurotoxin injections. The first patient developed swelling and erythema at the injection points 3 hours after injecting a brand called Neurotoxin. The second patient developed severe orbital swelling the day after a touch-up from a brand called Xeomin. The third patient developed eyelids and nose edema 2 hours after injecting Neuronox. All 3 patients used the neurotoxin before with no side effects. So the problem list, we have 3 patients who developed periorbital swelling after neurotoxin injections. The brands used are Neurotoxin, Xeomin, and Neuronox. All 3 patients tolerated the neurotoxin before with no side effects. So how would you face the case? Option A, conservative management. Option B, surgical treatment. The votes are in and you chose A.
Hello, my name is Basel Sharaf. I'm an aesthetic plastic surgeon and associate professor of plastic surgery at the Mayo Clinic. I want to thank Malke Asaad for the opportunity to present this interesting case. The correct answer for face the case is option A, which is conservative management. So here we have 3 cases of a neurotoxin touch-up, all resulting in swelling and erythema, and managed conservatively with resolution of symptoms. In the first case, a patient developed erythema and swelling in the forehead and lateral orbital area after the touch-up treatment 1 week after the initial treatment. The neurotoxin brand that was used at the touch-up was Neurotoxin. This, by the way, is not available in the United States, and we'll come to that later. The treatment by the author included antihistamines, an intramuscular dexamethasone injection, and a 10-day course of steroid taper. The patient also was instructed to perform lymphatic massage of the periorbital area, frequent blinking, and use warm compresses. She improved within 4 days of starting the treatment protocol, and all of her symptoms eventually resolved. The author's presumptive diagnosis was a delayed type allergic reaction. In the second case, a male patient developed severe orbital swelling after neurotoxin injection for forehead and glabellar wrinkles. This occurred a day after the touch-up session with a neurotoxin called Xeomin. In the third case, a female patient developed edema of her eyelids and nose after 20 units of a neurotoxin by the brand called Neuronox was injected in the forehead, glabella, and lateral orbit area. The patient received a single intramuscular dexamethasone injection and showed complete resolution of symptoms within 2 days of the treatment. So the incidence of edema or swelling at the injection sites after neurotoxin treatment is very rare, less than 2% based on the published literature. My differential diagnosis of edema or swelling after injection with the neurotoxin is allergic reaction, infection, or less commonly, lymphatic stasis or edema due to reduced muscle tone in that area. Despite the low incidence, it is important for us as practitioners to be aware of such allergic reactions. In this article, the author cautions against the use of non-FDA-approved products or their equivalent in Europe or other countries. The FDA recently issued an urgent alert to healthcare professionals and consumers regarding the discovery of counterfeit botulinum toxin in several states. Of note, an outbreak of botulism was also reported in Egypt in 2017, and many cases required hospitalization. It is important for us to ask the patients about any allergies or allergic reactions to previous injectables. It is important for us to also be able to manage those allergic reactions when they occur. Practitioners administering such neurotoxin treatments should be familiar with the protocols for managing them. For patients, it is important to verify the authenticity of the products being used prior to administration. Source verification is very important as federal law mandates that all healthcare professionals only dispense or administer prescription drugs, for which neurotoxin is one of them, from authorized suppliers. And it is important to educate our patients that the use of counterfeit neurotoxin is associated with increased risks, and they should only seek such treatments from licensed professionals using authentic products. So keep in mind that although uncommon, some of these reactions can occur, and be knowledgeable on how to manage them. In several cases in the literature, lymphatic massage, warm compresses, and frequent blinking was thought to be helpful. Read more interesting case reports every month on PRSGlobalOpen.com. We look forward to seeing you next time on PRS Global Open Face the Case. Thank you for watching.